Welcome to Prescription for Primary Care. Today we're going to talk about patient advocacy and healthcare transformation. And so we're joined by Cheryl Petruk, CEO and founder of Heal Canada. Cheryl brings a wealth of experience as a passionate patient advocate following her personal journey as a caregiver. With an MBA in community economic development and experience teaching HR and business courses, she brings a unique perspective to the healthcare landscape. She's currently enrolled in a DBA program with her thesis work focused on leadership in patient advocacy. Cheryl, thank you for being here today.
Thank you so much for having me.
So, you are a patient advocate, and can you tell me how you started on your journey to advocacy?
Absolutely. So many years ago, well, back in 1991, when my late husband, was diagnosed with essential thrombocythemia, that's a myeloproliferative neoplasm or blood cancer. That really started my journey as a caregiver and fundamentally as a patient advocate because I really needed to understand the diagnosis that he was given when he progressed to myelofibrosis in 2010. And so for those 15 or 17 years, he lived pretty asymptomatically, with his disease, and we monitored, and, his physician, his primary care physician monitored his condition. We really didn't know a lot about the disease, but when he progressed to myelofibrosis, that's when our advocacy or my advocacy kicked into high gear, knowing and finding out more about this, disease. And back then it was considered a blood disorder, but, soon after that diagnosis, it was, told to us that it was a blood cancer, a rarer type blood cancer. And so really at that point in time, I, became his advocate because I needed to know everything I could about the disease to help him live a better life. And I really got involved. We got involved in establishing the Canadian MPN Network, which is a patient advocacy organization for people with these blood cancers. And it's going strong today and has a great, community reach for patients who have an MPN, whether it's ET, essential thrombocythemia, polycythemia vera, or myelofibrosis. And so, got involved in that because I felt that if if I had the questions about the disease, there was others that probably had those same questions that were living, with fear and trepidation, and how could we, be better advocates for ourselves in learning more about the disease. So became very involved in that community. And then in 2018, I started Heal Canada, but really didn't have the time to focus on Heal Canada, but in 2022 reignited Heal Canada and really started focusing on being a broader patient advocate, because I felt that unfortunately my late husband, passed away in 2018, but I felt that I could take what I learned from his journey and apply that in a broader sense. So by establishing Heal Canada, we have two digital magazines, E3 Advocacy and My Blood, My Health, which focus on patient advocacy for, two different areas. E3 Advocacy being very generic advocacy for different areas, of treatments and diseases, and My Blood, My Health focusing on, blood matters and blood related issues. And then also really I learned a lot from being involved in a global perspective of patient advocacy training. When we all start, being patient advocates, we don't know what we don't know, right? And so it was really what I learned from other great people over in Europe was that we really need to provide that educational foundation for people who want to be advocates. And that's where my post-secondary, career teaching at some Ontario colleges kicked in and said, well, okay, if we can teach others, in business and healthcare administration and all those other great parts in our educational institutions, why can't we teach people to be better patient advocates? And so that's how Cash Education was born. It's really about bringing that whole, advocacy effort into one area so that people can learn, so that they can empower themselves, they can grow, and they can share their knowledge with the greater community. Because if they're diagnosed with something, maybe there is already an established community, how they can contribute better to that. Or maybe if there isn't an established community, how can we get that knowledge out there for these people to live better quality of life or get access to treatments or whatever their advocacy efforts are. So that's kind of in a
Mhm.
nutshell where we started.
Yeah, like education is a big deal. I mean, with my family as well. I mean, we were never, the medical healthcare system, it was there for us, but we always had the idea that we need to advocate for ourselves because doctors are overwhelmed and burdened, and, they can't take care of a million other things that, say someone like me who's in the midst of dealing with a child who has extreme eczema, he's not going to know every little thing about this kid. I'm also in the caregiving phase of my life with my mother-in-law and my mother. So and you're getting all this experience and education, and it can't, like, that kind of information is can't go to waste. It's like pure gold because
Absolutely.
everyone's gonna have this kind of um challenges in their lives, whether it's children.
Absolutely.
Yeah.
And that's exactly it. Our physicians and our healthcare practitioners, nurses, and allied professionals, they're all very smart people. They're all very well educated, but they're not perfect themselves. They're humans, right? And
Mm-hmm.
like you said, doctors and nurses are all overwhelmed, with the impact that our healthcare system and the impacts that it has. They're taxed to the max, and so I believe that they appreciate when patients come to them educated, when they come to them knowing and understanding what perhaps the disease or diagnosis that they have, and how can they best help themselves. Because doctors have always said, or the doctors that I've talked to have always said, they like educated patients because adherence to medications, understanding of the disease, just how they can help themselves be a better patient and navigate their own journeys, helps the medical practitioners, the primary healthcare or the HCPs, healthcare practitioners. It helps them be able to help the patient. So
Mm-hmm.
it is our responsibility to be our own advocates and help understand the journeys that we're being diagnosed with and given. And I think that helps us navigate our choices for
Yeah,
sure.
like, it has to be a partnership. It has to be that when you take your health into your own hands, you do feel empowered. Like when you know your own genetics and then you bring that to the table, like put it all in documentation, bring it to your doctor, research, save him like research time. um I find that, like, nowadays, yes, doctors are very appreciative of that. Back then, I remember a few times where, like, our old doctors would be like, oh, what are you, a doctor? You just researched on the internet, you don't know anything. But that's like old school. Nowadays, it's like definitely feels like doctors want more of a partnership with their patients.
Well, absolutely. And it is our life. It is
Yeah.
our lives. So we have a right to be the captain of that ship, right?
Mhm.
It's our ship that we're sailing, and we have the right. Now we're going to use the input from our well-educated physicians and medical community to help us navigate our journey. Absolutely. They're going to be our course, our maps and our course direction and our compasses to help guide us. But we're the captains of our ships, of our own lives. And you know what? Our destiny, is how we entrust the compass that we're using, the physicians that we're using as our compass, and the healthcare practitioners. But it's where we end up will be because of the decisions we make,
Mhm.
based on our healthcare practitioners and their guidance and their input into how
Yeah.
we'll get there. So kind of a bit of analogy, but I think it gives people a frame of mind of, you know what, being a patient advocate starts with you. Absolutely. So
Mhm.
people be better advocates, not only for themselves, but their communities, how they interact. If they choose to advocate on a community, there's going to be lots of people that they're going to interact with. And so giving people these tools, that's really important,
Mhm.
for them to be able to utilize as advocates or, in their roles as advocacy people.
Mhm. Yeah, like I love that analogy. You have to be the captain of your own ship, but it takes a crew to run that ship and keep it stable, right? So you need
Absolutely.
yeah, at Healthier, we believe like team-based care is the way to go, especially now with how this healthcare is struggling with the burden of it all. You can't just be an island on your own. Get healthcare providers there, get your doctor there, get your alternative healthcare, just get everything there.
I really like the ship analogy because we are the captains of our own journeys. And absolutely, our doctors and healthcare professionals are that compass. They're going to guide and direct us. We need to have a first mate and a crew and everyone to help us along with the journey. So exactly, it's taking that and that's what really patient advocacy is all about. Is creating that team, creating that understanding, and that's where, Heal Canada, I think fits in. Well, we've got lots of great patient advocacy groups. We need organizations to kind of bring us all together at times, or to give us information, or to give us that education. Because, it's great when you say, I'm going to start a patient advocacy group up for XYZ. Well, how do you start? Where do you start? And that's part of that education process. There's lots of us who have been in advocacy for a long time, and we learned by doing and by, trial and error. But when we can help people, accomplish their goals quicker, sooner, faster, then they're doing a better service to their community.
Mm-hmm. Mm-hmm. So
Sure.
what do you say is like the biggest challenges right now patients face when they're trying to navigate our healthcare system today?
I think one of the biggest challenges is that they face is time, entry into the healthcare system and, for a diagnosis or, also, I want to say expediency. Like, so everybody, what I always say, trust your doctors. If they need to see you in quickly, they're going to get you in quickly. If they know that they have some time to wait, or, that you're not, an acute case where you need to be seen right now, trust your doctor. They will attend to you, as soon as possible. So I think some of the challenges are waiting times, getting that first diagnosis. I think those are challenges, but it's really about having the information at our fingertips for ourselves. And that's getting better, I think, with electronic health records and having access to that, because patients are really, they want to know that information. So I think that's another challenge, is some doctors are hesitant for their patients to have that information. So I think that's another challenge, that, again, steering your own ship, you want to have that information. So I see that as being a challenge, but that's getting better over time. So I think there's a couple of challenges, time and waiting. Also, accurate diagnosis. So a lot of times our primary care physicians, while they're great at being, a general practitioner, sometimes they have to get us in to see specialists, and that's the wait time, right? And and the trepidation and the anxiety that comes, with that wait time to get in to see a specialist can be a challenge for patients. So I think, being able to streamline our processes a little bit better, so that that psychosocial aspect
Mm-hmm.
of our healthcare is addressed. And that's one other challenge, is people living with a disease. Our psychosocial aspect is not, you know, our doctors are great, don't get me wrong, they are, but they only have 20 minutes to see a patient in their clinic visit. And a lot of times they forget, how are you doing? How are you mentally dealing with having a
Mm-hmm.
rare blood cancer? How are you mentally dealing with having an incurable, and in our case, having an incurable blood cancer?
Mm-hmm.
It as it progressed, my late husband's mental state declined because he was having, and rightfully so, having issues comprehending and understanding what this was all meaning. And so our psychosocial aspect of our healthcare system, and I'm not saying mental health, but just addressing that psychosocial aspect of a diagnosis, I think is a challenge.
Yeah, that's the worst thing. We've all had experiences where we're just like waiting, I wish there was, I don't know if there's even people that like have that kind of job where they're specifically meant for people on the wait list, and to help them kind of, develop patients and support while they're waiting.
But that's where patient advocacy comes in, right? Support groups, patient support, groups that can help people, navigate their journeys and understand what they're going through, having that peer-to-peer relationship, like, so patients saying, it's okay, you know what, I've dealt with this, or I'm living with this, and you're going to be okay, not to worry, and so I think that's where patient advocacy and patient support groups fill that gap. But again, you have to have people who are well versed in that, and understand the disease, and have a bit of advocacy education behind them.
Mhm. So would you say that the landscape of patient advocacy has changed since you've started? Like since
Oh, absolutely. Yeah, absolutely. I think, the more support programs and some more support groups that are established to help people navigate those journeys, absolutely. Maybe there was the big organizations, the Canadian Cancer Society and Leukemia and Lymphoma Society of Canada, and Crohn's, disease, and Diabetes Canada, and Kidney Cancer Canada, like those big organizations, they've been established for a long time. But it's these smaller, more grassroots organizations that are really becoming more impactful and have more impact. And in the last 15 or 18 years that I've been involved in advocacy, people are wanting to be involved and establishing patient advocacy groups more, because it's more tangible for them. Not tangible in a monetary way, but tangible to get that information out, to have that support and those supportive relationships.
so so tell me about your digital magazine, Health
So
Canada. What was
I
the inspiration?
Well, so our digital magazines, our two digital magazines, of course, E3 Advocacy, it was really, came about sharing information, sharing patient advocacy information. And so we always have a topic for our magazines. Every second month, we put out E3 Advocacy. And, E3 Advocacy has several sections in it. It has a current section. So the upcoming magazine will be talking about access to medications. And then we have a living well. We have an emergent treatments or emerging treatment section. We have a living well section. We have a senior section. We have an advocacy spotlight where, new advocacy groups could be spotlighted for, so that their communities, will know about them. We have a pediatric section for people to talk about, where we talk about pediatric issues and diagnosis and treatments or therapies and things that relate to kids. We in the living well, we want to give people, we have a mental health section as well, because again, that mental health is always so vitally important to patients and advocates, and helping people navigate their own journeys. And so we just try and give advocates and patients and whoever wants to read the magazines, an opportunity for a really robust set of information in a full spectrum way. And our My Blood, My Health focuses on on blood conditions, again, blood cancers, blood disorders. And again, same thing, giving them some emerging treatments, giving them some not testimonial, but subject matter expert articles from physicians and healthcare practitioners, and giving advocates again that knowledge and understanding of perhaps having a blood cancer or a blood disorder, and how they can navigate that, and what they should be, talking about CAR T-cell treatment, or talking about different types of opportunities for them to help them navigate their journey. So it's really about, again, bringing together that information in a one-stop place, holistically, not specific to any one, treatment or disease area, but really giving people that information that they can share with their communities that will be applicable. Doesn't matter what disease you have. Living well is applicable, or mindfulness or mental health issues are applicable to any disease that people are living with. And so that's where the inspiration came from. And that's what we do, is try and give that holistic view of advocacy information for both E3 advocacy and My Blood, My Health.
Awesome. So do you have a personal story you can share where your advocacy helps someone or your groups help someone?
Oh, absolutely. Someone in a very close proximity to me, it's actually a social group that I belong to. They had indicated they'd gone to the hospital because they thought they had a stroke, and it ended up not being a stroke. And this person said to me, "Oh, but now they tell me I have." And I said, "Oh, essential thrombocythemia." And he goes, "How did you know that?" I said, "Too many platelets in your blood." Yeah, they said it's like thick blood. Yeah, absolutely. So here I've related my own personal journey with my late husband to this I would say a good friend that, now he's got a diagnosis with this. And so where I can now, I've helped this individual navigate his first steps in seeing a community hematologist, giving him questions to ask the doctors, giving him that opportunity to say, okay, what's my trajectory here? And helping him along the way and saying, okay, you should check for this, or you should ask your doctor for this. These are the things that you should look on your blood numbers, and stay aware of them. And so it's really about taking the knowledge that we've gained as individuals and sharing that with other people. And so this is something that I don't say this funnily, but here I could help this individual.
Yeah.
Little did I know that he had essential thrombocythemia.
Wow. Yeah, I find that happens too. It's many, many, many years ago, I had really bad postpartum depression. So I was the first in my family to kind of come out with this kind of issue because,
We don't talk about it.
but
Exactly.
after going through my experience, I was able to recognize it in a lot of other young women who had babies, and I knew exactly what they needed to help. And so I would go to their house so they could sleep, or talk to them. Even just talking just helped. In my case, it helped a lot. Just talking and crying,
Navigate it, exactly.
right?
And
And
this is, I don't want to say a normal thing, but this is something that can happen. And yeah, exactly. When you have somebody to confide in, when you have somebody to say, well, these are all symptoms of postpartum depression, you're okay. You're gonna be okay. Let's navigate through them. Let's get you the help that you need, and help them along their journey.
yeah, the thing I found the most helpful, and I just think in general most people find this helpful, is that when you're going through these issues, these challenges, it's hard to think straight. So
It
when
is.
you have someone who's calm, cool, and collected, and knows what they're talking about, and they tell you, okay, look, when you go to the doctor, ask them specifically, even write it down for them, ask them for this, tell them this, do this, and so you give that person who has the challenge something to really focus on, hold on to while you
Exactly.
go to the doctor's office. So it really helps kind of rein in all the crazies that's happening while you're
Abs-
going through the
abs-
challenges.
Absolutely. And I always tell people, when you're going to the doctor, bring someone with you, because
Mm-hmm.
you're focused on listening to what the doctor is telling you. That other person can come with a scribbler. I always say, get a scribbler, write down all your questions, write down your questions or your comments in between doctor's visits so you don't forget them. Write down anything interesting that may have happened, something that maybe has come up in between doctor's visits that the doctor will find of value to help in
Mm-hmm.
that continued diagnosis, right? And
Mm-hmm.
so yeah, absolutely, giving people some real tangible ways that they can take control of
Mm-hmm.
their disease, because when we have no control in a disease, the only control we have is knowledge. And by having that knowledge and that understanding, by writing everything down, interpreting that to the doctor or communicating that to your doctor, then they can make a better diagnosis. Then they can connect all those dots together to make the right picture, right?
Mm-hmm. Um, So, what do you have any resources that you like that's your go-to recommendations for people who want to become better advocates for themselves or for someone that they're caring for?
Absolutely. Take patient advocacy training. It's really, really important for you to get that foundation and that understanding. Learn as much as you can. Subscribe to our free magazines because it gives you information, it gives you resources. Do as much internet searching as you can or you need to know about your diagnosis and know about or the disease that you're advocating for. You have to educate yourself in many different ways in order for you to understand, to have that knowledge and that power, and to best be the advocate that you can be, whether that's just for your family member, your partner, for yourself. Because again, the more you know about your journey, the better you can navigate your ship.
Hmm. Now, seeing how we're in 2025, we're in the future basically. How would you see technology changing patient advocacy, like technology like artificial intelligence, AI?
Oh yeah, absolutely. It's never going away, right? It's here to stay. So yeah, you know what? I think that AI will be used in many different ways and shapes and forms. What it will do is there's lots of programs out there, AI programs that will help physicians better diagnose.
Hmm.
So primary care physicians. So instead of them saying, you know what, I don't have the answer, I don't know what this is, coming in with eczema and I don't know why. Your child has so much eczema or chronic eczema, or now they've got to go and they've got to look through all their medical books and things like that. There are portals that are being created, platforms that are being created where a doctor can type in the symptoms
Hmm.
and the AI can go through and say, okay, it could be A, B, or C. So now it's giving the primary care physician more time to treat, better, opportunity to say, okay, well, I remember learning about that, or I remember, reading something about that. And so now I can more pinpoint that diagnosis and get you on to a specialist quicker, sooner, faster, instead of waiting, because now that they've got a more refined understanding of what the disease or the issue that they're dealing with. So I think AI, will be of great benefit in many different ways, and that just being one of them, helping primary care physicians better diagnose quicker, faster, sooner, so that patients aren't waiting, so that they don't have that mental anxiety and that
Hmm.
trepidation of, well, what could it be? So I think, again, using AI in the right context and using it for the right reasons is going to be valuable
Hmm.
to our doctors and
So,
our healthcare physicians.
but do you think as a patient, as an individual, utilizing AI is a good idea, or is it on the road to like being overwhelmed?
It
Um,
depends. That really depends. I mean, we have Dr. Google, right now. People who, may not be comfortable with using AI, will type in their symptoms into Google or WebMD or whatever platform they're using. So they're kind of doing that now. They're kind of getting that information, beforehand. And AI, it can be right and it can be wrong. So we all have to be very cautious of that because it depends what you tell it or what you give it, what prompts you give it, how it will respond back. So if you give it the wrong prompts, you're going to get a totally wrong answer from it. So I think patients need to be wary of that, because again, you have to be able to know how to work with it in order for it to provide you valuable information. But I think best left to the doctors to make the diagnosis. I think the best thing that patients can do is track their symptoms, write down and make sure that they have all of that information at their fingertips so that they can give it to their healthcare practitioner so that they can make the diagnosis, because they're the trained people. They're the people that have gone to school for many years, who are the medical professionals. And so I think that, being in the technology era, we can still use the Google and everything else to kind of synthesize, what our symptoms are, but don't put all your eggs in that basket. Make sure that you understand your symptoms, understand what's happening with your body so that you can let the professionals
mhm.
make the best guess or make the best educated
Yeah, our
Decision.
I'm laughing because when you're talking about this, I remember our CEO, Dr. Raymond Rupert. He was we were talking about AI and healthcare, and he goes, "Yeah, like AI is is great. It can give you lots of information, but it can hallucinate too." so it's
Exactly.
so it's like it's just really funny. Like, yeah, AI can hallucinate and give you some really bizarre answers, so you cannot take everything that it says.
But it's no different than listening to people on the street, right? Or listening to somebody
Yeah.
who isn't informed. They could give you, they could sound like they're giving you all the right information because they're really good at talking the talk, but they might not be giving you the right information. So again, you can't believe what they say, just like you can't believe what AI says. So
Mhm.
formulate your own plan, write down all your symptoms or the issues that you're having. Take that to your medical professional and get
Mhm.
their subject matter experts. Let them
Mhm.
deal with the technology to help, come up with a better diagnosis or a
Yeah.
more pinpointed diagnosis.
So, as a patient advocate, so what would you like to see? What changes would you like to see in our healthcare system in Canada to really better support the patients?
Well, I think it's really looking at seeing patient advocacy as being a part of the ecosystem.
Mhm.
Putting credence to the patient programs or patient support groups. That we have a lot of times, healthcare professionals will, they'll either really embrace patient advocacy groups or they won't, and they'll say, oh, you don't need to talk to people, but yes, we do. Unless we put in a component of dealing with the psychosocial aspect of treating patients and navigating their diseases, that's the place that patient advocacy groups have, is creating a less anxious moment for our patients who are living with a disease. Because I go back to my late husband, and he lived with a disease that he had no control over, and he didn't know when it was going to progress. So patient advocates, they talk, patient advocacy groups, patients talk with one another, and they support one another, and they give value to the time that they spend together. Because, oh, if he or she is living with disease and we're kind of, at the same stage, okay, then maybe there's hope for me. Or this patient took this treatment option. Okay, maybe that's an opportunity for me. So, I want to say that's where patient advocacy needs to have a place at the table. In our healthcare ecosystem, we have to be seen as credible partners and
Mhm.
credible. Now, we're not the subject matter experts, not saying that at all, but we are from the psychosocial, the anxiety, the information. Again, patients who come to their doctors well informed, knowledgeable about their disease, knowledgeable about the trajectory of their disease, do better with their adherence to medications, understanding the disease better, and I think are overall better patients because of that
Mhm.
knowledge, understanding that they have, which helps the doctor, with their equation or their part of the equation that they are dealing with.
Mhm. Absolutely. Like, we're an anxious society in all levels. Like, and some of it we can control, some we can't. And but patient advocacy groups, I mean, I see such a huge place for them, especially when I read that that report that came out about the number of people that died on the wait list. Uh,
Yes.
like, we should have just given patient advocacy groups this wait list and just kind of go through it. And who knows how many people we could have saved just by easing their anxiety, because anxiety leads to so many stress related
Well,
issues.
absolutely. I always say when the brain is taxed, with anxiety and trepidation, and, it starts to formulate things, we know that physiological things happen. You could
Mhm.
get an ulcer, you could get an ache or a pain, or something else could happen. You could get a psychosomatic itch, or whatever, right? So when this is taxed, we know that physiological things happen. It's a circuit. And when physiological things happen, guess what? Then you start thinking, oh, is my disease progressing? Is it getting worse? Is it what's happening? So it's this circuit, that keeps going around and round and round. And if we can provide patients with a break in that circuit where we say, okay, you know what? Listen to your doctor. If they haven't told you to worry, don't worry yet. You can live with this, or listen to your doctor and do what they say to do. So we need to break that circuit, of
Mhm.
anxiety and issues happening because of that. So I think that's where patient advocacy groups, some doctors really embrace it, and really, they, when we started the Canadian MPN network, many years ago, we got pamphlets out, hand cards out to the doctors, and they would give that out to the patients, saying, hey, I think you would, benefit from meeting other patients or getting the education, because a lot of patient advocacy groups will bring doctors out to talk to patients about the diseases that they're representing or that they're advocating for. And so patients then have an opportunity to meet with healthcare practitioners and professionals and gain a better understanding through whether it be a webinar or an in-person group of speaking with the doctor or hearing more about the disease. So I think that really patient advocacy organizations really need to be part of that healthcare ecosystem.
Yeah, the table needs to be much bigger for,
Yeah,
like, we need you guys, we need nurse practitioners, we need like everyone.
absolutely.
But I think there's so much media out there about what's going on for the last few years, and I'm pretty sure a lot of Canadians are starting to wake up to what the healthcare system needs, and it involves many parts, not just the doctor. Okay, even patient advocacy groups. Thank you
Absolutely.
so much, Cheryl, for this great conversation. I mean, I loved hearing about what you do, and I can think of a few. I've spoken to some patient advocates as well, so I might, connect her to you.
Absolutely, absolutely. Because again, that's part of the beauty of patient advocacy is helping one another. It's amplifying each other's voices. Because you know what, together we stand stronger, and that's exactly it. The more people that we can enlighten, we can get our message out to, and that's part of why we do the digital magazines, is to amplify that voice. We put in
Mhm.
campaigns or awareness ads for many different patient advocacy groups, because all we ask is that they send the link out to the digital magazine to their community, because you never know when it will help one person, when
Mhm.
they'll read something about mindfulness or anxiety or whatever the issues are. Then we've helped one more person, right? Then we've amplified the voice of the greater community, and that's really what we're here for, is to help one
Mhm.
another.
So how can people connect with Heal Canada?
Visit our website, www.healcanada.org. Visit us. We've got lots of information there. All of our past digital magazine links are there. We're up to 10 issues. All of them are there. Please visit us at www.healcanada.org, and we'd love to hear from you.
Thank you, Cheryl. Awesome. Thank you for talking to us. To our listeners, the links that Cheryl mentioned will be in the description of the podcast. Make sure you like, share, subscribe. So whether you're a healthcare professional or a patient or a caregiver, and you want to contribute to a meaningful change in our healthcare system, just reach out to us at Healthion or Cheryl at Heal Canada. And thank you for joining us for another episode of Prescription for Primary Care. So until next time, good health and better health care.